Hi, I am Crystal Jean Elaces, and for this video, I'll be doing the return demonstration for urinary catheterization of a male client. Urinary catheterization is the introduction of urinary catheter through the urethra into the bladder for installation or removal of fluids. So the purpose of urinary catheterization is to relieve urinary retention, to obtain a sterile urine specimen, to measure the residual urine remaining in the bladder after voiding, to control urinary incontinence, to provide access for instilling medication into the bladder, to maintain an empty bladder during surgery, and lastly is to monitor early urine production in seriously ill client. For the materials needed, I have here the external douching tray, a bedpan with cover, plastic or metal, a waterproof underpad, bath blanket, and also a tray containing the following: pick-off forceps in a disinfectant solution, and also a working forceps in a sterile pack, a lubricating jelly, a betadine solution, and I also have here an alcohol, and a sterile dry cotton ball, and also I have here a cotton ball soaked in an alcohol, and of course the catheter. The sterile catheterization pack contains a drape, an OS or a goose pad, and the kidney basin. Equipment for indwelling catheter. We have here the Foley catheter, a sterile 5cc syringe filled with distilled water, a triple distilled water vial, a plaster, and a urinary bag. Of course, I have here the sterile and working gloves. Lastly is the lamp. First, I'll be performing a urinary catheterization on a male client. First step is to check the doctor's order. And second is assess whether client is allergic to iodine or plaster. Next is assemble equipment needed. Identify and explain the procedure to the client. Good morning, sir. I am Nurse Cristel. May I know your name, Bob? So, sir, I'll be doing the urinary catheterization. I just want you later, Bob, to take a deep breath and be comfortable while I am doing the procedure. Provide a good light. Provide for privacy by screening and closing the door. Or windows. Replace top sheet with bath blanket. Place waterproof underpad under the client. Place client in a supine position with the feet apart and drape the client. Prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. Open the pack and bring it near the perineal area. Observe a septic technique. Squeeze a small amount of lubricating over the sterile OS placed in a sterile field. Using a sterile pick-up forceps, get 2 cotton balls with antiseptic solution from the sterile jar and place in a sterile field on the top of several OS. Open the wrapper or plastic cover of the sterile specimen bottle and drop it on a sterile field. Wash hands. And put on working gloves. Do perineal care or flushing. And discard working gloves after cleaning the perineal area. Put sterile gloves. Grasp the upper corner of the fenestrated or eye drape and unfold it. Place the fenestrated drapes aseptically over the perineal area with the penis extending through the opening. Holding the penis with non-dominant hand, disinfect the meatus twice using cotton balls with betadine antiseptic solution. Starting from the top, use a circular motion stroke, then downward for each cotton balls and discard. Lubricate 6 to 8 inches of the catheter tip. Hold penis perpendicularly to the body and pull up gently. Hold the catheter in the dominant hand. Steadily insert the catheter about 8 inches until urine is noted in the drainage bag or tubing. Do not force the catheter through the urethra. Ask the client to breathe deeply, and rotate the catheter gently if slightly resistance is met. So, sir, I want you to take a deep breath. 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 Okay, that's it. Thank you, sir. So, hold the catheter securely with your non-dominant hand while the bladder empties. Collect a specimen about 20 to 30 ml if required. Continue drainage according to the hospital's policy. Remove the catheter smoothly and slowly. So if a Foley catheter is used, introduce 5 cc or follow manufacturer secure the catheter. Gently pull the catheter until retention balloon is snuggled against the bladder neck. Resistance will be met. Attach catheter to urine bag. Remove fenestrated drape. Place client in a comfortable position. Do aftercare of other equipment use. Attach catheter to urine bag below the level of the bladder. Tape catheter to lower abdominal area. Remove and clean the equipment and make client comfortable. Label the urine specimen and send to the laboratory promptly. Wash hands. Record the time of catheterization. The amount of the urine removed. The client's reaction to the procedure and observation. That would be all for my urinary catheterization male client.